जुगाड़ एआई में आपका स्वागत है दोस्तों। तो आज हम बात करने वाले हैं एआई डॉक्टर्स की। हाँ भाई, अगर आप मेडिकल स्टूडेंट या डॉक्टर हो तो ये वीडियो आपके लिए बहुत ही ज़्यादा ज़रूरी है। चलिए शुरू करते हैं वीडियो को और देखते हैं क्या एआई डॉक्टर्स की जॉब खा ले।
Hello there, I'm your virtual medical assistant. How can I help you today?
I have terrible abdominal pain.
For years, our team has been working to understand how AI might meaningfully augment the doctor-patient relationship. Today, we want to provide a transparent window into our progress.
Doctors have been talking about super intelligent medical AI for over 70 years. This is the most intellectually fascinating thing. Like, how do you evaluate machines that sort of act like human experts, but in other ways fail?
Having a very natural sort of diagnostic conversation without sacrificing deep clinical reasoning has been the core technical challenge.
You are about to see me pretend to be a patient with acute pancreatitis.
I can see you clearly. You appear uncomfortable, which makes sense with the pain you're describing and lack of ability to keep water down. To help pinpoint the cause, I'd like to perform a brief guided physical exam.
So this is a new type of system that doesn't just communicate on a typing text basis, but also can talk, and more importantly, can look at the patient through a camera and do or guide the patient through a physical examination.
Is the pain staying in that area, or does it move anywhere else, like towards your back or lower abdomen?
It mostly stays in that area, but I have felt some pain in my back.
Most doctors seeing this case, their mind would be screaming, does it radiate to the back? Does it radiate to the back? And it's really cool to see the reasoning traces and seeing that the model itself is thinking that as it goes.
To help pinpoint the cause, I'd like to perform a brief guided physical exam. If possible, could you lie down and expose your abdomen so I can see the area you mentioned?
No, but I can do it in the chair. No, my belly button doesn't hurt.
Okay, thank you for clarifying that the belly button itself doesn't hurt. Since the pain is around that area and is burning, could you try pressing just above it and tell me if that causes tenderness?
Oh, yeah. Oh, that really hurts. The AI asks me to palpate my belly button. It's not painful, and then adjusts its request for the physical exam based on that and says, can you actually palpate above it, which is the epigastric region, which is exactly where it is painful in acute pancreatitis, like in this case. That's exactly what a doctor would do, and is quite impressive. You can see in real time that it is reacting to our video and truly observing us and changing its assessment based on what it's seeing.
It's also doing what is generally a physical exam best practice, which is you want to start examining where you don't think it hurts for the patient first to get a sense on what their baseline is before moving to the painful area.
The agent is like laying out a very concrete plan as to what needs to be investigated and what strategy it would employ to actually reduce its diagnostic uncertainty.
Is it painful when you press down or when you let go?
Both. It just really hurts.
It's testing for what's called rebound tenderness. I mean, it's a good question. I personally would never ask a telehealth patient this. Rebound is generally something that a doctor would assess while the patient is lying down. It is definitely a good question. Again, if I'm asking about rebound tenderness, I would like this patient to be in front of me. It's not really something I would do via telehealth.
The intense burning pain around your belly button that hasn't stopped, the severe vomiting and inability to keep water down, and the tenderness you felt when pressing and letting go, I'm concerned this could be a serious medical issue like an appendicitis or pancreatitis. This requires immediate in-person evaluation. Please call emergency services or have someone take you to the nearest emergency room right away.
I think it's reasonable to have appendicitis or pancreatitis in the differential. And sometimes clinical encounters don't have an easy answer, as a multiple choice question does.
I certainly would rank the probabilities of those two different diagnoses very differently. And ultimately, what matters is the next steps. And from that perspective, the AI system was completely right. The next steps are going to be emergency care, vitals, rehydration, labs, and almost certainly in the United States context and in many parts of the world, a CT scan, which would give you sort of that definitive diagnosis.
At the emergency room, they will likely start by checking your vital signs like your blood pressure and pulse, as the vomiting can cause dehydration. They will then run blood tests to look for signs of infection or inflammation, and probably do imaging, like an ultrasound or a CT scan, to see if there's an issue with your appendix, pancreas, or gallbladder. They will likely give you IV fluids to rehydrate you and medication for the pain and nausea there. Does that sound like a clear plan?
It's interesting, isn't it? You can see in this clip that there is real progress in these systems, and they do clearly have some capabilities towards identifying the correct diagnoses, guiding a patient through an examination in a useful way, and even triaging what could be quite a serious medical complaint. But on the other hand, hopefully these clips also show where there is significant room for improvement in this system. And while it's early days, the promise is very clear.
I'm your virtual medical assistant. How can I help you today?
In this next case, Jason, who's a physician at Harvard, comes to his doctor with a complaint of an eyelid droop. It's a very interesting case because it requires a good doctor to ask some very sophisticated questions, but also to examine the patient carefully.
The patient is presenting with what I might call an unevoked sign. That is very obvious, of course, to any human who is watching this. And one of the questions is going to be, to what degree is it obvious to an AI system?
In this case, I'm pretending to be a patient with a condition called myasthenia gravis. It's never normal to have your eyelid droop like this. And we wanted to test, would the AI see that my eyelids were not normal, and would it ask about it?
I've noticed that my right eyelid is drooping a bit more recently than my left one.
I can see the drooping you're referring to in your right eyelid. When did you first notice this happening?
Maybe like a month ago.
I complained that my right eyelid is drooping, and it immediately looks at my face and verifies that my eyelid is indeed drooping. And it says in the thought log, which we have and we can evaluate, I see the patient's eyelid is drooping.
It did not say, oh, it looks like his eyelid is drooping. It only says that after the patient says that. So these are one of those really interesting findings that are different from humans to AI systems. Did the AI system really notice that? Had the patient just continued to talk about like the fact that he has insomnia, would it ever have brought up his droopy eye?
Have you noticed any changes in your pupil size, any double vision, or any pain in the eye?
No changes in my pupil size and no pain, but I do notice sometimes I see double.
Does the double vision happen more often at certain times of the day, like when you're tired?
Yeah, I notice that when I first wake up, it's not too bad. And then after about an hour or two, going about my day, my eyelid droops a little bit more and I see more double.
There's a very similar condition called Lambert-Eaton myasthenia, which gets better as the day goes on. So it's immediately asking one of the most important relevant questions that a neurologist would know to ask. So here we can see in the thought log that it says, the fatigable nature of ptosis and diplopia is double vision, and ptosis is the eyelid droop, strongly suggests conditions affecting neuromuscular junctions, prominently myasthenia gravis, which is a spot-on assessment.
Now, could you look up towards the ceiling and hold that gaze for about 30 seconds?
That is not just a cookie-cutter exam maneuver that you do on every patient. You actually almost never do this physical exam maneuver.
Like, this is quite impressive. This is a appropriate physical exam that's been adapted for telehealth. Maybe neurologists do this. I actually don't have a sense. There may be neurologists who do this through a telehealth setting, but I have never thought to do it, so it's pretty cool to watch.
Based on what we've discussed, the most likely possibility is myasthenia gravis. Other potential causes might include Lambert-Eaton myasthenic syndrome or something like a mechanical issue, but the fatigability makes myasthenia gravis the primary concern. The next step would be to perform some further tests and get a referral to a specialist, like a neurologist, to confirm the diagnosis and start treatment.
I generally agree with what the AI model is saying. This is a classic, almost stereotyped presentation of myasthenia gravis. More importantly than that, the model is correct. There's many more tests to be done, and a lot of those tests need to be done in person. So this should be seen relatively quickly by a neurologist.
If I saw this patient in my primary care clinic through a telehealth exam, I would have the exact same differential, the exact same reasoning, and the exact same next step.
Should I be really worried about anything with this disease?
While myasthenia gravis is a chronic condition, the good news is that it's often very manageable with treatment. Most people with it can lead full and active lives. The main thing to be aware of is that sometimes, in rare cases, it can affect breathing muscles, which is why it's important to have a specialist involved to monitor things. Are you concerned about any specific aspects of the disease?
This is very similar to what I would say when diagnosing a condition like this, which is to reassure the patient that it is a treatable condition and that they are capable of having a normal life.
The potential for AI in healthcare is tremendous, but these kind of technologies with real-time, low-latency, fluent video models are very new. And as our work has shown, they can have strengths and limitations in surprising and nuanced ways. The more perspectives brought to this, the better. And we hope that sharing these clips helps bring that to life.
Hello there, I'm your virtual medical assistant. How can I help you today?
Hello, my right shoulder really hurts and I wanted to have it checked out.
But what you're seeing in this example is how, with real-time, low-latency video processing, the AI system can do more than just take the history. It can actually perform a physical examination. That's looking for very subtle cues from the patient, but also instructing them through a range of movements and tests, which is the kind of thing a real doctor might do on a call. So you're about to see my colleague, Ryutano, one of the research scientists here at DeepMind, and he's role-playing a patient who's got a shoulder injury.
We constructed this vignette to show a gradual overuse injury.
And then we were very specific when you construct scenarios like this about what information you should volunteer and what information you should not volunteer unless explicitly asked.
I'm sorry to hear your right shoulder hurts. Does the pain get worse when you try to lift your arm, reach overhead, or do specific movements?
I think so.
Okay, that makes sense given your work. On a scale of 1 to 10, where 1 is no pain and 10 is the worst pain imaginable, how would you rate the pain now?
4 or 5 out of 10.
Sometimes a patient will come in trying to downplay their pain, looking comfortable, and you can't initially tell how much pain they're in. And you ask them this question, and sometimes they'll say, I'm in 10 out of 10 pain. And suddenly this is a pain that you have to take way more seriously than if they say, oh, it's actually a 1 or a 2. And sometimes you can see that written on people's faces, but sometimes you really can't. So it's a great question, and it's great that the AI asked it.
I'd like to see how you can move your shoulder. Could you please try to lift your right arm straight forward, then out to the side as high as you can without causing too much pain?
Okay, yeah, let me try that. Forward. Yeah, it hurts. Yeah, it hurts a bit. This moment is particularly interesting because it nicely showcases the video processing capability of our medical AI agent. So for example, looking through its internal thoughts, you see that the agent is noting quite detailed observations from the video feeds, first of all, such as the range of a specific movement that was tested through the initial step of the guided physical examination. But also, notably, the agent also noticed that the patient hesitated while performing this. In addition, the agent, impressively laid out what other movements still need to be tested in order to kind of ascertain what the diagnosis might be.
Thank you for doing that. It looked like you could raise your arm forward quite far, but it was painful. Now, could you please try to lift your arm straight out to the side, again, as high as you can without causing too much pain?
Oh yeah, this hurts. This hurts quite a bit.
One thing that I like about this exam is the model actually told him to do something that he didn't do. It asked him to go forward and go to the side. He only did one of the two, and then the model, of course, appropriately noticed that he only did one and asked him to do the other. That is a very human-like, but first of all, it's a very human-like tendency to ask the patient to do too many things, because it is cognitively dense to do multiple physical exam things. It's also very human-like to realize that you asked too much and go back. So I like that detail.
Thank you for showing me that. The pain you're experiencing with both forward raising and moving your arm out to the side, along with the stiffness and night pain you mentioned, suggests that you might have an issue with your rotator cuff, possibly involving impingement or tendinitis, which is consistent with your work history. For immediate management, I recommend continuing to rest the shoulder, applying ice periodically, and considering over-the-counter pain medication like ibuprofen if it's safe for you to take. It would also be beneficial to see a physical therapist who can provide tailored exercises. Depending on whether your symptoms improve, further imaging like an ultrasound or MRI might be necessary later.
It does do a good job here of recognizing that even if it is a rotator cuff injury, it's not so severe that the patient can't move their arm and they don't need an MRI now. That's a very important, when we see patients, one of the decisions we have to make is, do we need imaging now? Do we need an MRI? Or can we give it some time to heal with physical therapy and over-the-counter pain medications like Tylenol and ibuprofen? And it does make that correct assessment.
As Ryu is performing this exam and we're starting to see what motions cause him pain, I certainly am starting to think this sounds like rotator cuff tendinitis. However, my mind is very clear that there are other tests that we need to do. I think what is being demonstrated here is likely premature closure, and that there are still other physical exam signs that are very easy to do that could give us much more certainty.
Do I need a surgery?
Based on what we've discussed, surgery is usually not the first treatment option for the type of shoulder issue we suspect, like rotator cuff impingement or tendinitis. We usually try conservative treatments first, like rest, modifying your activity, especially at work, and physical therapy. Surgery is typically considered if these treatments don't improve your symptoms for several months, or if there's a significant tendon tear. Given your work, it would be wise to try to avoid carrying heavy things for a little while.
Everything it did was appropriate, but it just chose probably 3 of the 8 tests that would be most appropriate, and it definitely did not localize to exactly where. In particular, I would want to see the impingement testing done.
Reviewing the video, I don't think it's possible to say this was definitively a rotator cuff injury, or perhaps it was adhesive capsulitis. There are other items in the differential. But ultimately, the conservative treatment, that's what we call it, with physical therapy, rest, ice, ibuprofen, Tylenol, just over-the-counter medications, and seeing if it heals on its own was the right determination, and they appropriately gauged the acuity of the illness.
I think this is an interesting case in which you can see how the model gets the patient to perform a series of movements, but it's not just doing so in a random way or following in a kind of rigid fashion a series of rules. Rather, with each aspect of the examination, you can see that the AI system is attempting to interpret the findings, use those to sort through what could be the most likely diagnoses, and then intelligently reason through what the next aspects of the examination are that it should perform.